There is a quiet emergency happening inside your chest right now, and I don't mean that to frighten you. I mean it to wake you up. Most heart attacks in people over 60 don't announce themselves with a dramatic clutch the chest moment. They build slowly, silently, brick by brick. And three of the most overlooked reasons they build that way are not cholesterol, not blood pressure, and not genetics. They are mineral deficiencies that your body has been trying to signal for years in ways most people mistake for normal aging. If you have felt unexplained fatigue, occasional heart flutters, leg cramps at night, or blood pressure numbers that creep upward no matter what you eat, stay with me. Because what I am about to share with you may be the most important 15 minutes you invest in your heart health this year. I'm Dr. Alan Miller, and after 18 years treating cardiovascular risk in older adults, I've seen firsthand what happens when these warning signs go ignored. I have sat with patients who did everything right, exercised, ate well, avoided smoking, and still ended up in cardiac care because nobody told them that their heart muscle was starving for three specific minerals. Today, I am telling you. By the end of this video, you will know exactly which three minerals are most critical for lowering heart attack risk in people over 50, why each one works at the cellular level, and what you can start doing today to bring your levels back into the range your heart needs to stay strong. We are going to go through each mineral one by one, ranked from important to absolutely essential. And I need to flag something about mineral number 2 right now. It is the one most seniors are dangerously short on, and most doctors never test for it. Stay with me. Here is the truth that rarely gets explained clearly enough in a 15-minute doctor's appointment. When your physician orders a standard blood panel, they check your sodium, your potassium if you are lucky, and almost never your magnesium or selenium. Why? Not because those minerals do not matter, they matter enormously, but because the standard panel was designed decades ago to catch acute crises, not to optimize long-term cardiovascular health. The result is that millions of older adults walk around functionally depleted in the very minerals that keep their heart rhythm steady, their arteries flexible, and their blood pressure regulated. And because the symptoms of these deficiencies, fatigue, irregular heartbeats, muscle weakness, overlap perfectly with what most people chalk up to getting older, the deficiencies go unnoticed, unaddressed, until they are not a quiet problem anymore. I want to be clear, this is not your fault. The modern diet, the medications many seniors take, and the simple reality of how our bodies absorb nutrients less efficiently after 50 all conspire to create these gaps. The good news is that knowing the three minerals I am about to share with you puts the power firmly back in your hands. Let's start with potassium. You may have heard that bananas are a good source, and that is true. But here is what the banana conversation almost never includes. Potassium is the primary mineral responsible for regulating the electrical signals that keep your heart beating in a normal, steady rhythm. Every single heartbeat is triggered by a carefully orchestrated exchange of potassium and sodium across your heart muscle cells. When potassium levels fall, that exchange becomes chaotic. I had a patient, a retired school teacher named Dorothy, who was 68 years old when she came to me, complaining of what she called a fluttery chest. It happened mostly in the evenings. She was otherwise healthy, walked every day, and had no history of cardiac disease. When we ran a comprehensive panel, her potassium was sitting at the low end of normal, technically acceptable, but functionally insufficient for her heart. We adjusted her diet and added a potassium-rich foods protocol, and within 6 weeks, the fluttering stopped entirely. Dorothy called it a miracle. I called it physiology. Potassium also works directly on the walls of your blood vessels. It helps them stay relaxed and elastic, rather than tight and stiff. Stiff arteries mean higher blood pressure. Higher blood pressure means your heart works harder with every beat. Over years and decades, that extra workload is one of the most reliable paths toward a cardiac event. The recommended intake for adults over 50 is around 2,600 to 3,400 milligrams per day. Most seniors get significantly less. Beyond bananas, excellent sources include avocado, cooked spinach, sweet potato, white beans, and salmon. Please speak with your doctor before significantly changing your potassium intake, especially if you are on blood pressure medications or medications for kidney function, as potassium levels need careful management in those cases. Stay with me, because what comes next is the mineral most cardiologists wish more people knew about. Magnesium may be the most consequential deficiency in cardiovascular health that almost no one talks about. It is involved in over 300 biochemical reactions in the human body, but for your heart specifically, its role is staggering. Magnesium regulates your heartbeat by acting as a natural calcium blocker. Yes, it does something remarkably similar to the class of heart medications known as calcium channel blockers, but from within your own nutritional system. Here is what that means practically. When your magnesium levels are too low, calcium floods into your arterial smooth muscle cells unchecked. Those cells contract. Your arteries tighten. Your heart has to push harder. Your blood pressure rises. And the cells lining your arteries, your endothelium, begin to sustain low-level damage that, over time, becomes the foundation of plaque. Let me tell you about Robert, a 64-year-old former engineer who came to me with blood pressure that had climbed steadily over 5 years, despite his best efforts at diet and exercise. He was frustrated, almost defeated. His standard labs were always normal. But when I tested his red blood cell magnesium, which is a more accurate measure than serum magnesium, he was significantly depleted. This is extraordinarily common in men over 60, particularly those who drink coffee daily, experience regular stress, or take diuretics for blood pressure. All three applied to Robert. Within 3 months of targeted supplementation and dietary adjustment, his systolic pressure dropped 11 points. His cardiologist called it notable. I called it magnesium doing its job. The reasons seniors tend to be magnesium deficient are layered. We absorb it less efficiently from food as we age. Diuretics flush it out through the kidneys. Stress hormones deplete it. And the modern food supply is genuinely lower in magnesium than it was 50 years ago because of soil depletion. Foods richest in magnesium include dark leafy greens like spinach and Swiss chard, pumpkin seeds, almonds, black beans, dark chocolate, 70% cacao or higher, and whole grains. For supplementation, magnesium glycinate and magnesium malate tend to be the most absorbable forms and are gentlest on the digestive system. Typical supplemental doses range from 200 to 400 milligrams daily, but I always recommend discussing this with your physician before starting. We have covered 2 powerful minerals, but the third one is the one most people have never even considered in the context of heart health. And it may surprise you. Selenium is not a mineral most people associate with the heart. It lives in the shadow of its more famous counterparts. But the research on selenium and cardiovascular disease is compelling and has been accumulating for decades. Selenium is the backbone of a critical antioxidant enzyme called glutathione peroxidase. This enzyme is your heart's internal cleanup crew. It neutralizes the oxidative damage that, left unchecked, inflames and damages your arteries. Here is the connection that most people do not know. Oxidative stress, the damage caused by unstable molecules called free radicals, is now recognized as one of the central mechanisms behind atherosclerosis, which is the buildup of plaque inside your arteries that leads to heart attacks. Selenium is essential for your body's ability to fight that oxidative stress at the cellular level. Low selenium means a weakened defense. A weakened defense means your arterial walls sustain more cumulative damage over time. Beyond that, Selenium plays a direct role in regulating inflammation and in supporting thyroid function. And thyroid dysfunction, even subtle subclinical forms, is closely linked to elevated cardiovascular risk in older adults. The connections are layered, and they are real. I remember a patient, a 71-year-old woman named Margaret, who was managing mild hypothyroidism, unexplained fatigue, and borderline elevated inflammatory markers. Her selenium levels were tested almost by accident. I happened to run a comprehensive micronutrient panel. She was in the low quartile. We introduced 2 Brazil nuts per day into her routine. 2 Brazil nuts contain roughly 150 to 200 micrograms of selenium, well within the safe and effective range. And over the following months, her inflammatory markers normalized, and her fatigue lifted noticeably. 2 Brazil nuts. Every day. That was the intervention. I want to flag something important here. Selenium operates in a narrow therapeutic window. Too little, and your heart's oxidative defenses suffer. Too much, consistent high-dose supplementation over 400 micrograms per day can cause toxicity. This is a case where food sources are far preferable to high-dose supplements, and where any supplementation should involve a physician conversation. Brazil nuts, tuna, sardines, eggs, sunflower seeds, and whole wheat bread are all excellent dietary sources. For most seniors, food first is the right strategy. Here is what I want you to take away from everything I have shared today. Your heart is not failing you. In many cases, it is simply not receiving the raw materials it needs to do its job. Potassium to keep your rhythm steady and your arteries relaxed. Magnesium to protect your vessel walls and regulate your blood pressure from the inside. Selenium to neutralize the oxidative damage that quietly erodes your cardiovascular system year after year. These are not exotic interventions. They are fundamental biological needs that the aging body struggles increasingly to meet without intentional support. And knowing that, truly understanding it, gives you something that no prescription can give you. It gives you agency. Here is your 5-step action plan, and you can begin all of these today. Step 1. Ask your doctor to test your potassium, red blood cell magnesium, and selenium levels at your next appointment. A standard panel may not include all 3. Ask specifically. Knowledge is your starting point. Step 2. Add 1 potassium-rich food to your daily routine. A medium sweet potato, half an avocado, or a cup of cooked spinach each gives you a meaningful boost without any supplementation complexity. Step 3. Consider magnesium glycinate supplementation at 200 to 400 milligrams before bed. It also supports better sleep quality, a secondary cardiac benefit that is well established in the research. Step 4. Eat 2 Brazil nuts every day for your selenium. Set them out on the counter next to your coffee or tea as a visual reminder. Consistency at a low dose is far safer and more effective than sporadic high-dose supplementation. Step 5. Do not change any existing medications or prescribed treatments without consulting your physician first. These minerals work with your medical care, not instead of it. Your doctor needs to be part of this conversation. Your heart has been working every single minute of your life without a day off. It deserves the minerals it needs to keep going strong. If this video helped you see your heart health in a new way, please share it with someone you care about, a spouse, a sibling, a friend over 50. It costs nothing to share, and it might mean everything to them. I want to hear from you. In the comments below, tell me, which of these 3 minerals surprised you the most? Were you already taking any of them? Let's talk. Your experience might help someone else reading these comments take their first step. And if you want to go deeper on the magnesium conversation specifically, because there is a great deal more to say about how it affects sleep, muscle function, and blood sugar regulation, make sure you are subscribed, because that video is coming next.